recommended to the federal government.
On 16th Thursday 2026 July, a medical expert and the managing director of Eshita Tab Study Group, Dr. Nandul Durfa, has called on the federal government to establish local production of anti-snake venom to reduce death from snake bite across Nigeria. Dr. Dufa said Nigerian dependence on imported antivenoms has made treatment expensive and often inaccessible, stressing that the local manufacturer would save lives, lower costs, and strengthen the country's healthcare system. Following the recommendation, the Eshitatab initiative launched in 1990 through the partnership between Nigerian Federal Ministry of Health and a researcher from the United Kingdom led to the development of effective antivenoms against deadly snake, including the saw-scare viper, puffer adder, and black-naked spitting cobra. The clinical trial at the Katongo General Hospital in Gombe State confirmed the safety and the effectiveness of the treatment. Dr. Dufa urged the federal government to increase funding for snakebite research, establish antivenom production facility, and ensure nationwide distribution
Nandul
of the
Durfa.
life-saving medicine, particularly during the rainy season when snake case rise. He noted that investing in the local production will improve access to treatment, create jobs, and strengthen Nigeria's response to snake emergency.
Now retired, but we are not tired. Presently, uh, we are working with Professor Nasidi as in production of anti-snake venom in collaboration with a farm in UK. We call it Microfarm UK Limited, and also with the University of Costa Rica in Central America, the Instituto Comodoro Picado, ICP. They produce the antivenom for us. The wells one produced, we call it Equitab G. It's a monovalent, that is effective against one species of snake, that is carpet viper. Because carpet viper is responsible for almost 97% of cases of poisonous snake bite in Nigeria. Knowledge of Equitab antivenom, which is one of the most serious medical emergency, public health emergency in Nigeria, has been very poor. That's the language I'll use it. For the past 3 years, let's say two, comfort only Plateau State government has bought it on 2 occasions. Gombe State government, some years ago, they used to collect it quarterly. And after Governor Goje left, we have not been able to supply them. And honestly, government patronage is not encouraging at all. The production of anti-snake venom in Nigeria, we started very well. In 2006, President Obasanjo approved the production of the anti-venom in Nigeria to be financed through Millennium Development Goals. And honestly, up to the time the DG left, she never responded. The second occasion, we applied again through through the Ministry of Industries, supported by Ministry of Health during President Buhari's era. Through the Secretary, Head of Service, Professor Gambari, directed the CBN that there was a program like that, vote for a program like that, they should honor it. The CBN did internal review of the recommendation, and we learned that they approved the memo presented. But up to the time I saw the CBN governor holding a Bible from one court to another, they never replied us. So it is a program that has the highest approval at the highest level, but implementation has been scattered by administrative procedures. Strongly recommended to the federal government that we have gone farming, going to the farm, or food production or food security is a major policy of this government. And indeed, when you go to the farm, that is when we have the highest number of contact. And the farmers who are supposed to give us food security, they are at the highest risk. I recommend the collaborators in UK and Costa Rica are ready to transfer the technology without much problem. And if we produce it in Nigeria, we can sell it at the African trade venue and get external source of funding apart from our consumption and keeping our farmers and herders and children free. So I strongly recommend them to review it again and approve. I'm sure this government has been doing wonderfully well in terms of encouraging of production or local manufacturing, especially on health. So I'm sure they can be able to review it and make it functional.